Okay. Good morning to Professor and everyone. Thank you for being here today. I'm excited to take you through our presentation. I appreciate your time and attention as we begin. Today, we are from Group 3. I'm Wajihah BINTI MUBIN, and my ID number is 2023485576, and this is my partner.
And me, ALIFAH ILYANA binti OTHMAN, and my ID number is 2023449336.
We are going to present about rising diabetes rates in Malaysia. First, I will present about the introduction of diabetes. Diabetes is widely recognized as a chronic disease that has affected humanity for thousands of years. Despite this early awareness, effective treatment were non-static and the disease was often fatal, leading to severe complications and early death. It wasn't until the 20th century, in 1921, that a groundbreaking discovery revolutionized the management of diabetes, the isolation of insulin by Canadian scientists. This discovery transformed diabetes from a death sentence into a manageable condition, offering patients the possibility of leading longer, healthier lives with the help of insulin therapy. Next is the credibility. We also chose this topic because it's very personal to us. My late grandfather had diabetes. He loved sweet foods, especially desserts. Even though we tried to stop him, he didn't listen. Sadly, he developed chronic diabetes and passed away because of it. So from his experience, we learned how important it is to prevent this disease from affecting of our lives. Next, I will pass to ALIFAH ILYANA for the next presentation.
Thank you, Wajihah, for the clear and good explanation. Next, we move to the background of the topic. Before we look at the data, let's first understand what diabetes actually is. According to the World Health Organization 2023, diabetes is a chronic disease. It happens either because the pancreas does not produce enough insulin or because the body cells cannot use insulin properly. Over time, diabetes that help control blood sugar level without enough insulin or proper use of insulin, sugar stays in the blood and leads to health problems. Over time, diabetes can cause serious complications such as heart attacks, strokes, and other life-threatening conditions. The main purpose of our presentation today is to show how common diabetes is becoming in Malaysia and what we can do to prevent it. We will look at two important points. The first one is what Malaysians believe can help prevent diabetes complication, and the second one is at what age most Malaysians are diagnosed with diabetes.
Next, we will move to the graphs. So we are using the same types for graphs, which is just graph bar. First purpose is to identify how Malaysians believe a person with diabetes can prevent related complications. Second purpose is to examine the relationship between the age groups and number of patients diagnosed with diabetes. So we're moving on to the first graph. This bar graph shows that the percentage of Malaysians who believe that certain actions can prevent diabetes complications. As you can see that the highest percentage, which is 96%, believe that reducing sugar intake can prevent complications. Close behind it, it is 95% think that regular exercise helps, and 94% believe that taking medications according to the doctor's instruction is effective. We can see that there was a sharp rise in belief towards sugar reduction and exercise compared to other methods. Meanwhile, there is slightly down to 83% of people believe that communicating with healthcare providers is important, and far from it, it is 67% agreed that eating more vegetables and less meat helps. So in conclusion, this indicates that Malaysians are increasingly aware of the importance of making lifestyle changes in adhering to prescribed medication to maintain their health. However, there is still considerable room to promote and encourage healthier eating habits among population. While many recognize the value of exercise and medical treatment, destroyed choices remain an area that requires greater attention. Next, I will pass to ALIFAH ILYANA for the next presentation.
Now, let's move to the second graph. This graph shows the distribution of patients who were diagnosed with type 2 diabetes mellitus T2DM in Malaysia. The data comes from the National Diabetes Registry Report 2013 to 2019, published by the Ministry of Health Malaysia. When we look at the graph, we can observe a clear age-related pattern. The number of people diagnosed with diabetes start to rise sharply from around the age of 30 years old. The cases continue to increase significantly and reach their peak in the 50 to 54 age group. At this age group, the number of new diagnoses begins to decrease steadily. It shows that type 2 diabetes is not just a disease of the elderly anymore. Many Malaysians are getting diagnosed as early as their 30s and 40s. The sharp rise among adults means the early screening and preventive measures should start at a younger age rather than waiting until other adulthood. Therefore, public health campaign must target younger adults to encourage healthier living habits before they develop serious problems. To conclude, our finding shows that diabetes is a growing health problem in Malaysia, affecting people at a younger age than before. The graph we shared highlight the important point that many Malaysians already believe that healthy habits like reducing sugar exercising and following doctor's advice can help prevent diabetes complication. It is very important for all of us to take action by eating a balanced diet, staying physically active and avoiding smoking. Together, this step can help lower the number of diabetes cases in the Malaysia. Let's make health a priority, not just for ourselves, but also for our family and communities. I hope this presentation inspired you to take care of your health, and let's spread awareness together. Thank you for your attention and listening.
I think that's all from us. Thank you.
Thank you. Now, I request that groups 1 to 3